and basically from Alan's keynote specifically, so that we know that these are the symptoms that we will see in our clinical practice. Some are of academic purpose, but some are real authentic clinical symptoms. And how will patients present to you? How will you see them in your clinics? Observational, clinical, subjective, objective. That's what we learn. So far in acids, we have studied that there is a prostration, weakness, and different acids have different presentations and different sphere of action. That's very interesting. So today we'll see muriatic acid, which has specific actions on the gastrointestinal tract and a little bit on cardiovascular tract, urinary tract, and sexual system. Constitution, we see that it is adapted to persons with black hair, dark eyes, dark complexion. The person is irritable, peevish, disposed to anger and chagrin. We see this very often in many patients like nux vomica, aesculus, those who basically have portal congestion. If you just try to understand this aspect and try to find a commonality between people who are very much angry, who are very much aggravated by least offenses, they are the ones who will either be very sensitive or they will have portal congestion. Their seat of anger is usually affected and your anger is one of the main causes which over a period of time piles up and causes lot of neuroendocrinological disturbances. Portal circulation is affected on that level. So you will see that muriatic acid is mentioned for peevish, disposed to anger and chagrin. Restlessness and vertigo is there. Nux vomica is another remedy that is mentioned. Diseases of asthenic type with moaning, unconsciousness and fretfulness. Now imagine a situation which is almost into collapse. Patient is having barely any energy. She or he wants to do something but he is not able to do because of lack of energy on the physical level. That's where he will start moaning, he will start uttering some words. Moaning, especially in fevers, you will see pulsatilla, pyrogen. In all other conditions which are debilitating, you will see muriatic acid is one of the top remedies. Great debility, as soon as he sits down, his eyes close, lower jaw hangs down, slides in bed. So it's not a person, muriatic acid will not be a person who will just lie down or sit down and you will see him that he is sitting in that position. He will not have the energy to hold himself. We have seen this in growing children, Ethusa, Natramure, all these children who cannot hold their neck. But here in muriatic acid, what you will see is that they will collapse in the bed and they will not have the energy to even get up. There is such a bad weakness and debility, which is actually common for all the acids. In muriatic acid, it is even more progressive and debilitating. Cannot bear the sight or thought of meat. You see, the other remedy mentioned is nitric acid. Malignant affections of the mouth, studded with ulcers, deep perforating, having a black and dark base, offensive, foul breath, intense prostration, diphtheria, scarlatina, cancer. So the diseases that are mentioned all are terminally ill diseases from the patient who has a point of no return. And whenever you have a diagnosis which is directly mentioned in the patient's reports from other doctors, or you know that this is the diagnosis from the patient symptoms, you should directly jump onto the remedies or the group of remedies which have these. It can be metals, we have discussed in the past, and acids which come after the metals in our discussion, because there is a profound debility. Both have different spheres of actions, different modalities. You can choose that which is required. So in muriatic acid you will see malignancy. It will start from something that is basic and the disease has evolved into malignancy. That's where you will need muriatic acid. If it is something basic, functional, it may require kali bichromicum, or it may require sulfur, it may require calcarea, graphitis, lyco. if it has progressed and no one has helped the patient at that point of time where he needed help in functional problems, pathology has developed, think of muriatic acid as one of the strong remedies. Ulceration with fungus like growths, pseudomembranous deposits of the intestinal tracts. Now this is very interesting. Wherever you see that there is a kind of a new coating that has developed, mucus discharges are happening, that's where you can think of muriatic acid as one of the top remedies. Mouth and anus are chiefly affected, tongue and sphincter ani are paralyzed. So the processes which are the basic inlet and outlet for a patient, mouth and sphincter ani, they both have lost their function to resist and hold what they have to, and that's where the problem begins and ends. For muriatic acid, these are the seat of affections and you can prescribe very easily if the pathology is also situated in these areas. If the anus is very sensitive with or without hemorrhoids, anus is sore during menses, think of muriatic acid. So there are many patients who are developing piles, but there is no piles, there is no swelling, but their anal region, their rectal region is very sensitive. They tell you that it is causing a slight of a kind of a burning. There is a slight pain, and I cannot bear the clothes or whatever napkin to touch. That's where you can think of muriatic acid to begin, and it will totally abort the entire disease process which is developing. Hemorrhoids, if they are swollen, they are blue, sensitive, painful to touch, appear suddenly in children. So all cases of children who have hemorrhoids, you should think of one of the top remedies is muriatic acid. And whatever is the general picture in all the patients, children or adults, you will see that least touch aggravates, even the sheet is uncomfortable and prolapse during urination. So we already discussed that mouth and rectal region, anal region have been paralyzed, and this paralysis is kind of a local paralysis like causticum, and while urinating there should be a sphincter ani which is constricted. It does not allow the stool to pass, but here it kind of releases it because of the neurological disturbances, gastrointestinal affections, and you will see that muriatic acid has that seat of affection in that area where prolapse has happened with the urination. It is causing some discharges to happen, or there is prolapse per se. Diarrhea, stool involuntary while urinating on passing wind. Aloes is one of the top remedies we have seen earlier. Muriatic acid also can be thought. Cannot urinate without having to move the bowels at the same time. So you saw that prolapse and urination go together hand in hand, and that's what we see in different areas. Patients will tell you that with the diarrhea there is profuse urination which goes together. That's where you can think of muriatic acid as one of the top remedies. Palpitation of the heart is felt in the face. Urine passes slowly, bladder is weak and must wait for a long time, has to press so that the urine protrudes. Now you will see that many times patients, especially old age, where the function is gradually losing its grip over the nerves and the muscles, and that's where the patients will tell you that there is kind of a debility in those areas. You can think of muriatic acid very strongly. Cannot bear least touch in the sexual sphere, we will see. Not even of the sheet on the genitals. Murex is one of the remedies. Muriatic acid is one of the remedies. Those who are hypersensitive, those who have lot of hypersensitivity in the sexual region, you can think of remedies like caladium, muriatic acid, murex, etc. etc. Next you will see is freckles, eczema solaris. You will see that there are a lot of eruptions or acne like sunburns in the face. Think of muriatic acid as one of the top remedies for those patients. Next and last we will see fever or typhoid, typhus, deep stupid sleep, unconscious while awake. So they are awake but they are not aware of what's happening in the surroundings. They will keep on answering something. Loud moaning, muttering, we see this often in the functional cases. You should think of pulsatilla, pyrogen. In cases which are bordering on septicemia, you should think of pyrogen, and cases which have developed pathologies, muriatic acid should be one of the top remedies you can think of. Tongue is coated at the edges, shrunken, dry leather like paralyzed, involuntary fetid stools while passing urine, sliding down in the bed. We have seen this so many times in muriatic acid, and pulse every third beat intermits. This is very rare to find and hard to find, but other things you will find very easily. Patient who is lying down in the bed, collapsed condition, moaning, half eyes open or eyes are open and he is just muttering something. That's what should give you a fair idea of muriatic acid to prescribe. But it should be a pathology or bordering on pathology. It seems to be us that patient is going from the functional level to the pathological level, and we need to give something deeper to bring him out from it. That's what sums up muriatic acid for you all. In fact, wherever you have given bryonia and lustox in fevers or muxol in fevers or in other pathologies, muriatic acid is one of the top remedies that will follow it well. It cures the muscular weakness following any overdosage or overtaking of the drugs like which are made from opium or tobacco. You can think of this remedy alongside with other tobacco aggravation remedies. So that's what comes to an end for muriatic acid, and a few remedies are left from Alan's keynotes and we'll finish it, and something interesting coming up soon for all the people who are staying attached to this learning portal.